we're in some type of great controversy. All of us can feel it right now. And I think we just can't afford to give into these dark, lonely feelings. We just have to just keep riding it out. We have to have faith that indeed our faith will pull us through these times.
Hello, critical thinkers. Welcome to this new episode of Healthy and Awake podcast. Here, we question the conventional, explore the unconventional, and seek truth in health and wellness. I'm your host, Mike Vera, board-certified health coach and founder of Avantia Health Optimization. Today's episode is really a groundbreaking episode. We have a returning guest, Dr. Peter McCullough, and it is beyond an honor to speak with him because he is highly educated, he's well accomplished, he's a truth warrior, he's out there really saying what he believes to be true, and he does it with such integrity, and I mean, I could go on and on. So let me tell you a little bit about his background here. Really, he's well accomplished. There's so much I could say, but I'm just going to give you some of the bullet points. Dr. Peter McCullough is a cardiologist, internist, and epidemiologist. He holds degrees from Baylor University, University of Texas Southwestern Medical School, and the University of Michigan School of Public Health. He is one of the most published researchers in the United States, especially on the topic of cardiology. He has been a prominent voice regarding COVID-19, advocating for early treatment strategies, and even testifying before multiple U.S. Senate committees. He is also the recipient of many awards, some of them including Defender of Freedom Award, Humanitarian Physician of the Year, and Truth in Science Award. And perhaps most importantly, at least with regard to this show, he is healthy and awake. He is a warrior for truth, and he is out there really doing everything he can to help bring awareness to some of these very serious issues. So this episode heavily explores COVID as well as some of the associated illnesses that are being talked about in the media right now, like bird flu and monkeypox, as well as some of the negative consequences of those injectable products that were really pushed on us. And even a personal question at the end that I think may have been the heaviest question, at least for me it was. And it was interesting to hear his answer. So from start to finish, this is really one of the most valuable episodes that I've ever put out. And so without further ado, Dr. Peter McCullough. Dr. Peter McCullough, thank you so much for coming back on the show. It's an honor to have you back here. And I want to start quite differently than I usually do. This will be very quick, but I was thinking to myself, how can I show my appreciation? There's only so much I can do. I'm a little guy in this space, and I know you do so much. So hopefully you can see this on the screen. This is the Most Healthy and Awake Award here on Healthy and Awake Podcast. This is the first ever that I've done, and I feel like there's no one on the planet more appropriate to receive this. And I'll just read it very quickly. Dr. Peter McCullough's unwavering commitment to the truth in health and wellness, his courage in challenging the status quo, and his dedication to empowering individuals to think critically and make informed decisions about their health. Your contributions have not only inspired countless people to seek deeper understanding, but have also exemplified what it means to be truly healthy and awake. So I know it's small, but it is a token of recognition and appreciation. So I thank you very much for the work that you do.
Mike, I am truly honored and thrilled to join your audience. Send me that certificate. Now, I just published another certificate from a cardiology meeting today on LinkedIn, and they took down my account for violating the community rules. So we'll have to see how this certificate survives. So it seems like any accolade, any progress that we're making, these social media platforms just have a severe response to any progress that we make. Now, recently I was hacked on Twitter. It turns out about 48 hours ago, I was hacked by Twitter. Friends started commenting that. I said, listen, something's really erratic with your account. And it turns out myself, Children's Health Defense, John Campbell, Naomi Wolf, it was the same day that former President Trump and Elon Musk got cyber attacked when they tried to have the conversation on Twitter. So they had gotten into people's accounts, changed the emails and coordinates. We couldn't get into the accounts when we tried to get re-verified. I mean, this was a real mess. And I had Twitter tech support, multiple people. I was on a first name basis with them. And now I'm back in, but my account's severely limited right now. So nothing appears to be safe. The tensions that exist right now and censorship, what we see in the UK, New Zealand, across Europe is striking. And quite honestly, it's alarming.
Well, that's unfortunate. LinkedIn is actually my biggest platform, and I know very well that you have to be very careful in what you say. And it seems like the slightest little thing they go after you for. And I'm sorry to hear you got hacked on Twitter and or X. But things seem to be heating up. I know last time we've spoken about propaganda terms. We've talked about disease X. We talked about Nuremberg. And there's actually been some new developments, I believe, today from the World Health Organization with a monkeypox declaration. And just as a reminder, I think we're going to try to get this on YouTube. So I'm going to be very mindful about the word choices that I use here. But what's your take on this new announcement from the World Health Organization?
Well, mpox is an orthomyxovirus, so it's in the same classification as cowpox, camelpox, smallpox, and it's endemic in the Congo region. And there they handle not only monkeys, farmers and animal handlers, but they also handle giant pouch rats, and that's the main source of the pathogen. And there it's a lot of handling. So it's on the hands. And you'll see out on social media today a picture of someone who's handling it, and the hands are full of these pox blisters. Now, fortunately, it's a skin rash. It's a mild disease. The only deaths that have occurred in the United States are largely patients with HIV disease who had lots of other problems. But in Africa, people can die of secondary staph or strep infections if they don't get good care. We've got a very effective oral and IV drug called tecovirimat. So we used it here in Dallas. And really what's neat is to ship some tecovirimat over to Africa to settle this down. And they have to re-examine, do they need to be handling these pouch rats? I guess they use them as a food supply, or even the monkeys for that reason. Now, in the outbreak that started several years ago, it actually got into the male, gay, and bisexual community in some raves in Europe, and that's how it spread. So a paper by Thornhill and colleagues in the New England Journal of Medicine described that the vast majority of contact and spread in the United States was through gay and bisexual male contact. Actually, just a lot of anal intercourse is how it was spread. Now, we did have a case in Dallas of a man. It wasn't from gay or bisexual. He actually came from Africa, and it was written up in the CDC. And this was interesting. He flew over and he went to Atlanta, visited some friends in Atlanta, didn't spread it to anybody there. Then flew over to Dallas, didn't spread it to anybody there. And someone noticed a rash, on his hands and arms and said, listen, you may have it. He went to the hospital and it was correctly identified, and he was treated with tecovirimat, and he's perfectly fine. So the point is, the type of illness that the Africans are getting is not highly contagious at all. It's directly from the animals, called a zoonosis. The gay and bisexual spread, that's different. That's really largely occurring. The serious cases are occurring in HIV patients. We had such an HIV patient here in Dallas, a woman. And there, the issues are safe sex, again, early use of tecovirimat, secondary antibiotics. Now, recently I have a Substack coming out in this. Those who had the smallpox vaccine, smallpox vaccine was phased out in 1972 in the United States, but I had it. There is partial protection for people who took the smallpox vaccine. That's what we know there. There is a Jynneos Bavarian Nordic product for inoculation that has been associated with myocarditis. So I don't recommend that for anyone.
I think it's interesting because, as I mentioned last time that we spoke, we talked quite a bit about disease X, and it seems like mpox, bird flu, and still talks of COVID simultaneously, all around the same time that many of these rational theorists, as you put it, predicted would happen around this time of the year. And I know even Bill Gates himself predicted that this was inevitable. So, I mean, it's hard to think that this is a coincidence. I mean, do you have any thoughts on that?
Does appear to be convergence. Now, Gabby, as well as CEPI, the Coalition for Epidemic Preparedness Innovation, WHO, World Health Organization, World Economic Forum, Gates. They've all said disease X is H5N1 avian influenza, that is going to be the next major area of concern. So we've been in a slow-moving outbreak since late 2020, early 2021. The current clade, which is 2.3.4.46. Our research at McCullough Foundation, Nicholas Hoscher, first author, indicates that it's a product of gain-of-function research, serial passage research done out of the USDA Poultry Research Center in Athens, Georgia, assisted by University of Wisconsin School of Veterinary Medicine and Erasmus University in the Netherlands. And there, they got the organism to pass from chicken into mallard ducks, and then on to mammals, sea mammals, and then cattle. So the host range was extended, but it's a markedly weaker, less pathogenic infection. So in humans, just been some mild pink eye, doesn't transfer very well to humans at all. No large numbers of poultry deaths. We don't see mallard ducks, dying out there at all. I've been looking very carefully every time I see ducks, because it's obvious when the animals get sick in nature. You see it obviously, and so it's very mild. So we've concluded that we don't need to have any mass PCR testing of the chickens. We don't need to cull them. We don't need to kill healthy poultry because we can't eradicate it because the mallard ducks keep spreading it back and forth to the ponds. You can tell that the public health agencies are way behind. So they're not even talking about the spread being the migratory waterfowl. That's how it's spreading all over. They simply are mystified why it pops up in Texas or Michigan or Colorado or Iowa. And we certainly don't need inoculation programs for poultry. The Chinese have tried that for decades, and it doesn't work. Actually, it makes more resistant strains, propagates the problem. And we certainly don't need them for humans. And the current product is the 2021 FDA approved CSL Sequarians Audens product. And that was, of course, there's not enough cases to actually see if it actually prevents the illness. But there, what they did, Mike, is they tested normal human volunteers just for an antibody response. And there were normal human volunteers who died after taking this antigen-based product. So I was shocked that A, it was FDA approved, and number two, that the European Commission agreed to purchase 40 million doses of this. And in Finland, they've already started the human mass campaign. So I've advised farmers, no mass testing on the property. Just let the chickens get through it. Let the humans get through it. No inoculation programs at all, no culling. And we've researched this at McCullough Foundation, dilute povidone iodine or dilute Lugol's iodine, just very dilute. Eye drops work for the conjunctivitis, homemade in saline. The iodine nasal sprays and adding iodine to gargles works just fine. If I was a worker, I'd probably do that every day when I came home because there's just too much dander, too much exposure to it. And at Wellness Company, we've expanded the contagion kit to include oseltamivir, which has coverage if applied early, as well as hydroxychloroquine has coverage early. It also includes azithromycin for the rare unanticipated case of a secondary staphylococcal pneumonia, budesonide if needed. Remember, with various forms of influenza, they don't die of the viral illness; they die of the secondary bacterial infection. And so the mortality rate being quoted with H5N1 is not applicable anymore. These are cases decades old from Southeast Asia where there's a massive exposure, families sleeping with chickens, no hospital care, late initiation of anything, poor nutrition. We've actually never had a human death due to this illness in the United States.
So it really seems like round two in almost every sense of the word, because in many ways, this event is manufactured, or at least it seems that way. It seems like they're trying to present a single solution for it. They're trying to possibly blow it out of proportion. there are viable preventative and even treatment options for this. So, I mean, is that the case? Are we really in for round two, or do you think that there's really something that might happen to stop this, or something we can do to stop this?
Well, remember with the pandemic of 2020, we were caught flat-footed. I certainly wasn't prepared. I had no talking points. I had not researched this ahead of time. We were way behind in telling our patients what to do. With this crisis, this has been, ever since 2020, 2021, we even have peer-reviewed publications on this. We know it's a product of gain-of-function research. We know the testing done on farms, it's all government-driven. They're using the Fisher VetMax test, and we know how to handle it. We actually have, there's actually 4 FDA-approved antivirals for influenza. So this is so different. The messaging is so out front and helpful. I haven't had a single patient express concern. I have patients coming off farms in West Texas. They know what to do. There's no fear. There's no alarm. I don't know anybody lining up to take the CSL Sequarius product. No one.
Well, kind of related back onto COVID. I know recently Fauci admitted that he was sick again, despite getting those inoculations. And, it's hard not to laugh because this was pushed as really the holy grail for us. And it seems not to work very well, at least according to examples like this from many public figures, not just Fauci. Is it the case that these people who take these products get more sick? Because even the people I know personally, that they've been getting sick quite a bit.
Well, the Australian inquiry into this actually has a term of reference. It's called VAIDS. And you know what V stands for? And the AIDS is acquired immunodeficiency syndrome. And there are data from Shretha in college, from Cleveland Clinic, 51,000 workers. Those who took the most administrations got the most number of recurrent episodes of this. It completely backfires. Now, remember, when we look at efficacy for a product class like this, it's always theoretical. It's not actual, right? So if you took one of these in the arm and you never got exposed to the illness, you don't know if it worked or not, right? You can't claim that as a victory because you didn't get exposed. Now, if you took it in the arm and you've already had the illness and you have natural immunity, well, the natural immunity is probably preventing the next case, not the biotech product. So you don't have it there. If you have natural immunity, which most people do, and you come in contact with it, it may be so mild that you think you just have a cold and you don't even get a test, right? So it's only if, you take it the arm, you get sick with the characteristic signs and symptoms, and you get a test like Fauci or Biden, do you declare a failure? So all these claims that it was effective, no one can possibly know that because it's only theoretical. I mean, the final claim that people make, which is not even in the consent form, never been shown in randomized trials, is that they reduce the risk of hospitalization and death. And it can't be the case, again, because you never know whether or not someone gets exposed to it. And even when someone gets ill, what really carries the protection against hospitalization and death is early treatment. So people get early treatment. So both Fauci and Biden immediately disclosed they're getting early treatment. And then natural immunity from the prior infection. So in a paper by Chin and colleagues, it was shown in the U.S. prison system by 2022, is if there was natural immunity, there was a 0 risk of hospitalization and death. 0. And it didn't matter if someone had taken it in the arm or not. So I can tell you right now, as we sit here today, I don't think there's any real way to perceive that they did anything for anybody. And it makes you wonder why Fauci or Biden would even disclose that they took another test and then embarrass themselves on top of it. It really makes you wonder. You'd think that they would not take a test, Or if they did, they wouldn't disclose the results and declared that they have some benefit. But they're, in a sense, they're making themselves just a laughing stock of product failure.
You took the words right out of my mouth. I mean, it's embarrassing. How do we make sense of this? Because you would think they would keep their mouth shut on this after telling the whole world this was the answer, and it's, they're basically announcing that it's not working. So, do you have any sense of why they're not embarrassed and why they would even admit this in the first place?
Well, I give them credit for honesty, that they really took it. Biden actually publicly disclosed every single administration. We at McCullough Foundation, we actually made up a little card for him showing the dates, and apparently he took one brand all the way through.
Hmm.
And their honesty for disclosing to America that essentially they don't work. I think what they're trying to say is, well, since I took it, I'm going to get through it at home. Well, I can tell you, I got people in 2020 with a much more severe uh, strain. I got people through it at home with McCullough protocol, which is a multi-drug protocol. Even in 90-year-olds, people on oxygen tanks, senior citizens, and in a paper by Verdkirk and Lindley, they clearly showed the only people who ever really got sick with the illness were those who got insufficient early treatment.
Hmm. Well, I know one thing that many people are worried about who either did take this product or just in general for their loved ones. I was recently talking with my friend who's a neurosurgeon, Dr. Jack Cruz, who maybe you know,
Mm,
and he informed me about the presence of something called SV40, simian virus
mm,
40, in these
mhm.
medications. Is that something you're familiar with?
Yeah, very concerning development. 4 labs around the world have examined the vials of the products. Now, these are the single-stranded deoxynucleated pseudouracanated products, and they examined them. Now, 2 of those labs actually have publications in the preprint server system you can look at, quoted by Spiegler and colleagues and McKernan and colleagues. You can take a look at the data. But they found that they were contaminated with small fragments of DNA. And the DNA is what you just said, SV40, simian virus 40, the promoter, the enhancer, and the origin of insertion. So why is the simian virus segments being used? It turns out that the code for the ribodeoxynucleated acid, the code for that is actually DNA. And the DNA is inserted in E. coli and taken up into plasmids, little circular pieces of DNA in the cytoplasm. And the SV40 segments ramp up production of the ribodeoxynucleic acid, like, to create massive amounts of the product. And then it's interesting, they also put in antibiotic resistance genes. So then they introduce antibiotics to the system and kill all the E. coli that haven't taken up the branded code. That way they can harvest lots of amounts of the branded code. And both companies use the same process. And that's how they make it. Now, it turns out that there's certain levels of detection if you're going to use this method. It's a very dangerous method because SV40 is a known proto-oncogene activator. It's so dangerous that that early on, some of the polio products got contaminated in production. And I know this because at the time that they were being administered, the injectable polio, I was one of the people in those years that got one of the products. So I know it well. There's a concern that in fact people got injected with cancer-promoting segments. This is such a big deal that the Florida Surgeon General Joe Ladapo, and was an MD, PhD, trained at Harvard, wrote up the results. Worked with the scientists, sent this to the CDC and FDA, and they responded back slowly and said they have no concerns he demanded that they inspect the vials. And the US and FDA refused to open the vials and inspect what's in them. Every country, by the way, refuses to inspect the vials. I think everybody should be really concerned about that. The inspections that I saw in 2022 were simply visible inspections of the vial. So literally just for visible impurities. We inspect Tylenol and all these other medicinal products. Here you have some brand new biotech products that were in many ways forced into people for years. And every country in the world refuses to inspect them for quality and purity.
If I'm not mistaken, I know you mentioned the Florida Surgeon General. I believe he speculated that this SV40 might be contributing to these turbo cancers that we talked about in the last episode. Is that possible?
It's certainly possible. Now, for cancer, I've thought about this carefully. For most solid organ cancers, let's say a colon cancer, lung cancer, breast cancer, from the time the very first cancer cell forms, Mike, to the time you have a tumor that you could actually detect on a mammogram or colonoscopy, that's about 5 years. It's about 5 years. So if someone took it in the arm and then a year later they have cancer, almost certainly it was there, before one took the new product. So the theory here is that the products are markedly accentuating the progression. So they're what's called, activators. They activate these cancer genes. So SV40 would play a role, but also the spike protein would play a role. Spike protein inhibits P53 and BRCA tumor surveillance systems that would allow tumors to go unchecked. That's now been actually shown in some cancers, including colon cancer. And then lastly, the ribodeoxynucleic acid, that almost certainly impairs DNA repair. So we have multiple mechanisms by which these products could in a sense, cause or propagate a terminal cancer. This is summarized in work published by Anguis and Bustos and colleagues in Springer Nature Curious. So I'd point the readers there. And per my tradition, and I'll always cite the data when we have it at hand.
Hey folks, are you ready to take control of your health and feel your best? At Avantia Health Optimization, which is my health coaching company, we get that everyone is different. So we tailor our coaching programs just for you. Meaning we're not just handing you some cookie cutter program. We're not giving you some documents and saying, hey, just here, go do this on your own. No, we listen to your goals. We hear what you're trying to accomplish. We learn about your habits and routines and time management and approaches and everything in between. And it is completely tailored to you. So if you're dealing with stress, sleep issues, weight loss, changing your diet, being consistent with exercise, or if you just want to feel more vibrant and awake, our health coaches are here to help. Now, for a limited time, you can try our health coaching for just $1. Yes, your first health coaching session is just $1. It's a great way to see how personalized health coaching can make a real difference in your life. And it is just $1 because I know a lot of people have never tried health coaching. They don't really know what it's all about. A lot of people still think that I'm a personal trainer, which is not at all what I do as a health coach. So if you want some proof about how we've helped people, you can check out the testimonials on our website from clients who have already transformed their health with us. Head over to AvantiaHealthOptimization.com, or if it's easier, you can go to MikeVera.com. That's Mike, V as in Victor, ERA.com to learn more and snag your $1 first session today. So let's get started on your journey to a healthier, more awake you with Avantia Health Optimization. Now back to the show. So this is some, pretty scary stuff. I know a lot of people who have taken these products. They have gotten more sick. I mean, even some of my own family, unfortunately, has experienced some crazy illnesses. And I know we did discuss this a little bit last time, but for anyone who maybe hasn't heard that episode, what can people do if they've already, landed themselves in this situation?
Well, they should ask their oncologist to carefully look at the tissue. So we're now in the paper by Holscher and myself in the preprint server system. We describe a man who had a fatal cardiac arrest and had an autopsy done. And they didn't do any of the things that would be needed to identify the cause. So we're now proposing that reverse qPCR done to identify the biotech product that's physically there in the tissue. So that actually can be done using reverse qPCR. And then we actually stain for the S protein. So there are now tissue stains that can stain for it. So there shouldn't be a single cancer specimen out there that doesn't have these fundamental things done, because people want to know they took it in the arm and now they've got a turbo cancer. Are the two connected? The pathologist must do these tests.
And would those tests position the patient to have some kind of legal recourse?
Right now, the companies have immunity from liability through the 1986 Vaccine Injury Compensation Act and in the 2005 PrEP Act. So they are heavily protected. So that means the manufacturers and the biodefense contractors that physically make the products. But who's not protected are the schools, the employers, the agencies that mandated these products, particularly early on, when we had no idea if they were safe and effective. No one could have possibly mandated them. And actually, the legal standard that's used, Mike, is what's called substantial encouragement. So did a school or did an employer, did they substantially encourage the use of these? And you can usually get emails from human resources and others that was, clearly encouraging these or promoting these. And in fact, if that occurred and someone took it and they were harmed, now that employer or that school comes into the liability crosshairs.
It's really a shame. And I feel for these people because I know, most people who took these products did it because they were afraid. They wanted to protect themselves and solve a problem. And as far as I can tell from our discussion so far today, it just creates a whole host of other problems.
Yeah, I know. Most of my patients tell me, listen, doc, I took them in 2021. It was before we knew all this. They came out and I greatly regret it. I recently looked at CDC administration data. They now are using a third party to capture the Walgreens and CVS administration, which is where virtually all of the products are being administered. And the answer is through 2024, through the end of April, only 1.6% of Americans took one of the products in the arm. 1.6. Virtually no one's taking them now, Mike.
This actually goes perfectly into my next question, because even if we don't take those anymore and we know better, we do our due diligence, I've seen some mumblings about Bill Gates's mosquitoes that are, I think, infused with the same technology, and even further, lettuce being infused with the same technology. I don't know if they're actually doing that yet, but I think it's at least been proposed. Is there any hope for us who do know better?
People are alarmed with a paper by Zhang and colleagues that was able to get a small segment of code, made exogenously. It was coding for the receptor binding domain of the S protein. They were able to get that to be absorbed in a mammalian GI tract in a milk bubble, basically. And we've seen other experiments. The USDA, if you go on their website, is trying very hard to get foreign genetic material to be ingested in juices and vegetables and other products and into the human system. And, they have aspirations of having us, essentially be immunized against hepatitis B and other products through the food supply. But I have reviewed this on my Substack, Courageous Discourse. You want to take a look at it. The one product that looked like it worked was, believe it or not, watermelon juice, that they were able to get it to cross into the human GI tract. So people are becoming very wary right now of contamination of the food supply, contamination of, potentially the air. People have talked about aerosolized products, what's called secondary transmission. So someone takes it and then they kind of in their cloud or in their transference cloud that they secondarily immunize someone else. And And, there's great concern, honestly, about bug bites. And as you mentioned, mosquitoes, which are going from person to person. All of these have turned out to be a nightmare. There is a tremendous hesitancy now. And the rates of people refusing all of this class of products is very high and growing higher. I bet the next Kaiser Family Foundation survey, which is a very pro-V institution, is going to report on this and find huge numbers of families are just refusing the entire schedule.
Well, I'm glad people are waking up more and faster, but I'll tell you what, I know a lot of academics who haven't changed their position one iota since day one, and it's only the academics, right? Everybody else seems to get this. I'm wondering if anything we've discussed so far, those academics, they seem to think, well, these efforts are done from a benevolent purpose. They're really trying to help us and solve these challenging issues that, what do you think is really behind all this?
There's been a tremendous deference to authority in academic medicine. I never thought I've seen this. Before the pandemic, if a guideline came out on cholesterol management, I distinctly remember this at the cardiology meetings, immediately there would be a debate set up at the major meetings. Oh, the new guidelines are worthless. We don't do this. We're going to do that. And people would challenge the guidelines. And the guidelines were set up almost as a punching bag so we could advance our field. But yet when the guidelines came out for pandemic management, no academic institution attempted to do better than the bare bones government guidelines. It was stunning. There wasn't the Harvard protocol or the Mayo protocol. There was no development of ambulatory protocols to keep people out of the hospital. It was just the opposite of what we normally saw in academic debate. And then when the new biotech products came out, there was no review of safety. And we've seen tremendous product safety review. In cardiology, we had a safety review of Vioxx. Oh my gosh, there were Vioxx symposiums and people were reviewing Vioxx and they were reviewing the safety of so many other products. And, there's hundreds and hundreds of products that are pulled off the market. And there's papers written about them. So there is an entire history of drug safety research. And with the new sets of biotech products, zero safety research, zero symposiums, grand rounds. And then it turns out they weren't safe. So as people started, suffering these injury syndromes, becoming disabled and dying, because there was no safety research, there was no management research. So there's been no research into what tests we should do, how we should manage these problems. Patients are scrambling. So much like they were scrambling in the early days with the acute respiratory illness, now they're scrambling on the back end with these iatrogenic injuries.
So we don't learn our lesson, but I still don't exactly understand why, so I understand what you said, but why is this the case? And I'll be clear. I've heard you use the term New World Order. I've heard you talk about Klaus Schwab. And I know that's not your own term. Those are the terms that they've used openly. I mean, how does that factor into all this?
I think initially it was driven by fear. People were fearful of getting it themselves. And, when you're in a wartime situation, remember the PrEP Act, in a sense, treats a pandemic like a war. And they use the term countermeasures. Countermeasures means Army tanks going down the street. So in the setting of a war, if we were being invaded, we would have to follow government orders because we're at war. And I think a lot of people fell into that mindset. We have to follow government orders because we're at war. That's the reason why no one changed the protocols. No one advanced the protocols. But then when the new injectable products came out, people started to take it and they didn't turn out to be good. No academic medical center stood up and said, listen, this is wrong. People are developing myocarditis or blood clots or sadly dying, despite the literature, medical literature pouring out, the safety databases, going off the rails. FDA and CDC never shut down the program. No country in the world has shut this down 4 years later, almost as if we're kind of at war and we're taking on all of these collateral casualties. So I think it's a mindset. Now, I have used the term ideology. that particularly with immunization, doctors have, for hundreds of years now fallen into this ideology. And the ideology is really a scientific hubris, if you will, that, mankind can make God's creation stronger and more resilient if they take these products. And it's through human invention that makes the human body better. And that hubris is carried out and effectuated with this type of mantra that, the products aren't perfect. So for everyone to benefit, everybody has to take it. And that if there are casualties and people are harmed, it's like, sorry, they have to take it for the team. And that's really been the government's stance in this entire thing. If you notice, none of the government agencies appear to be particularly sympathetic. React 19 is one of the big patient injury groups. They were going to meet with Peter Marks and the FDA. They were going to meet face to face. The FDA at the last minute said, we can't do this. And they just met by Zoom. So they won't face the people that have been harmed face to face. Doctors are gaslighting patients. They're telling patients, nope, it's not due to this. We don't know what it's due to, but it's not due to this in the arm.
And I know there's probably some cognitive dissonance there for the doctors who have taken it themselves also. But yeah, it is presented as the greater good. And it's very much, it makes me think of the Great Leap Forward. So much evil has been done in the name of the greater good. And at least I think Alberta is making steps to ban these things. Have you heard about that?
Alberta's tried. There are some districts or precincts in Idaho, Florida. We have the Association of American Physicians and Surgeons independent group. It's actually an older society. Most of the top doctors are in that. In year 2000, they passed a resolution that no injectable product like this should be ever mandated for school. They saw these school mandates happen. They said, wait a minute, none of them are sufficiently compelling that they should ever be effectively mandated or forced into someone's body. That was in the year 2000. Now, in 2023, same group said, listen, for the current set of products, pull them off the market. World Council for Health was ahead of them in 2022, said pull them off the market. I expressed concern in a sworn testimony in 2021, and then in 2022, I called for them removed from the market. So we didn't pull the trigger, too early. Everyone gave them a chance to work, but when they looked frankly dangerous and they weren't working, responsible people called for them to be removed from the market.
Do you have any sense of what the timeline might be in the United States for similar measures?
I don't think they'll ever be pulled. In fact, the hubris on the new genetic technology is through the roof. Moderna's got 31 new products. The U.S. is a development partner with Moderna. They have an influenza vaccine, a respiratory syncytial virus vaccine. They don't even have basic pharmacokinetics, pharmacodynamics, no oncogenicity, teratogenicity, cardiotoxicity studies. The preclinical studies still haven't been done. And the company and the regulatory agencies don't seem to care. So they have no assurances that these are safe. And they're simply now saying there's a predicate standard, and that is the current set of products that code for the S protein. So something is off the rails now. Another example of this is respiratory syncytial virus, RSV. There's been a huge explosion of testing, so it's raised the case counts. This is an illness that virtually every kid under age 1 gets, and they get through it and get natural immunity. Now, since October, every baby born is receiving an injection of Beyfortus, which is nirsevimab, and that is a monoclonal antibody against RSV. We have no idea what this is going to do to a baby's immune system. We have no assurances that this is safe. 8 months, they get another injection. They actually get double the dose at 8 months. Again, no quality assurance here on safety, drug interactions, how this plays. And now data out of France, Helene Benoun and colleagues are reporting that infant mortality is up in France, that there may be what's called antibody-dependent enhancement, that in fact these shots backfire and make the infection, which is typically a mild infection, far more serious.
That's quite disturbing. And, I actually have people in my life right now, women who are pregnant. And I'm a little scared about what's going to be pushed on them. And they're in a vulnerable position. They might be susceptible to making questionable decisions when they're in that vulnerable position. So, I mean, if you were speaking directly to a pregnant future mom, what would you tell them?
World Council for Health, September of 2023, made the call. Now, remember, they're an international body. They're kind of a parallel organization to the World Health Organization. World Council for Health is advising to go natural, to take none of these products, none. So that means no Beyfortus, no hepatitis B on the first day of life, nothing. Just have the baby with the mother. Let the mother, breastfeed the baby, guard the baby, develop that critical bonding. None of these painful shots on the first day of life at all. Matter of fact, none whatsoever through the course of childhood,
The
provided
new technologies, or you mean in general?
no, provided they're a normal baby, none of the new or old immunizations, none. And there's 5 studies supporting this because, again, most of these are legacy illnesses because of improved sanitation, water supply. We don't have these threats. We have antibiotics that cover most of the infections anyway. We actually just don't need them. They never really worked very well. They don't provide enduring protection. And it's better to go natural. You're not going to have any allergic reactions to anything. If you don't get injected, you can't have an immediate allergic reaction. Not going to have a horrible situation with the febrile seizure. We know in the first couple of years of life, there are batteries of products all given together, and there's a risk that there's a severe fever. You take 12 of these, the body's trying to respond to 12 different antigens, and some of them are live attenuated products where there's actually live virions in this little baby's body. If the baby does evoke a fever, there's a paper by Nielsen and colleagues from Europe demonstrating that there's about a 40% chance the febrile seizure will result in a neuropsychiatric disorder like autism spectrum disorder. This is important. Children overall face about a 4% childhood risk of a febrile seizure because it can happen with a strep throat or, another infection. But a leading cause of febrile seizures is kind of these routine products given in combination. It's too much for the baby. And many parents now are onto this. And they've seen the disaster of having a severely autistic child, and it's completely avoidable.
Well, it is family that I'm thinking about. I have family who's expecting, so I thank you for that, and I'm going to make sure it gets to her, and of course,
Yeah.
anyone in my audience. I'm not exactly sure how to articulate this next question, so it might sound a little messy, and forgive me if it does. But I've been thinking about how we ended up here and all these problems that have been created by the injection. And I'm thinking fast forward 5, 10 years where the science has advanced to a point where we find what might be the perfect solution to this. As far as I can tell, if we've caused disruption with modifying DNA through an injection, the ultimate answer might be another injection. Is that a solid line of logic there?
There is a paper by Hosher, Mariota, and myself has now been fully accepted peer-reviewed publication suggesting that we could actually deactivate some of these strands of genetic code by using small interfering ribonucleic acid. We do this right now, by the way. In cardiology, I can use patirisan as well as in Clinzaran, I used to use mipomersin. These small interfering segments of code, they simply bind to the longer tail and shut off any more production of the S protein. So in theory, they would work great in a sense as an antidote. There's another way to just kind of lock the genetic code for the deleterious antigen, and that is what's called ribotech technology. So I think these will come along. The $1 million question is what you're implying is, are they reverse transcribed? Is the code, is a mirror image of the code put into human DNA where we couldn't do anything about it? And boy, let's hope that isn't the case. One paper by Alden and colleagues from Malmo, Sweden, Yang de Maridis, senior author, does show, at least in the human hepatoma cell line where the cells are rapidly dividing, that in fact, the center portion of one of the company's code was taken up into human DNA within about an hour. and it was 444 base pairs. Now, the group believes if that center portion is taken up, the whole thing is taken up. If that's the case, if people are permanently genetically transformed by taking these, the issues on the table are staggering about, passing this on to children, birth defects, diseases, new unusual diseases in children. Infertility comes up as an issue. And we know that the quantity of product is insufficient to change the genetic code of every single cell. So it's going to be a mosaic of cells. Maybe the body can turn over these cells and there's not really a perceptible impact. But boy, what a misadventure it was to choose genetic technology out of the gate for the world's first emergency mass vac program.
Well, let's assume for the sake of argument, it's not permanent, and this is the answer to the problems we've created. I'm sure you can understand how that might sound scary to a lot of people, how basically the technology that caused these problems, it sounds like almost the same technology is being presented to solve it. I mean, do you have any way to alleviate those concerns?
Yeah, well, the small interfering products are, again, very small. They don't have significant side effects. They're widely used now in a problem called cardiac amyloidosis or in patients with familial hypercholesterolemia. So we have a track record of using them. They are not modified like the current sets of products. They're not long lasting. They last in the body about 3 days. It's interesting that when we use these forms of genetic products, there was a multi-year development timeline, pharmacokinetics, pharmacodynamics, all the standard preclinical toxicity dossier, and they were proved to be safe. It just goes to show you can use, genetic products, ribonucleic acid products, and have them be safe, but they need to go through these traditional pathways.
Gotcha. Well, I know we're getting close to time here. I have just 3 questions left, so I'll be concise. Obviously, the vote is coming up pretty soon. It's close to November, and I'm wondering if you have any advice for people on how to think about voting. Is it Kamala? Do we know something about her that she might help? I know Trump's the one who created warp speed, and as far as I can tell, RFK seems, at least to me, to be the best choice. Do you have any thoughts politically?
Yeah, I'm a political independent, so I haven't endorsed any of the candidates. Like you, I'm going to look at everybody pretty carefully. I think with RFK, it sounds like there's still technical issues of him getting on the ballot. Can we actually vote? Most of us understand in the United States, we're largely Democratic, Republican. Then there's some small parties like the Libertarian Party. Now, I spoke at the Libertarian Convention, and the ticket they picked, Chase Daniels and Mike Termat, it's just not a ticket I can support. I could support Mike, but not Daniels. So we're down to Republican versus Democrat. We're going to have to weed through this. The big ticket issue we've been talking about is this mass public campaign that's been a debacle. Neither candidate has come out and recognized this. None of them have proposed ways to handle these injuries, disabilities. None. So, for the big issue that's affecting me and my practice, no candidate, at least the major Republican or Democratic candidates have not addressed it. So, I would say parenthetically too, that we have such a closely divided country that the candidates have to get votes from the other side. And right now, their method of campaigning is to insult the other side. And so it's very hard to get votes from people that are being insulted in their campaign rally. So each is just stoking their base and insulting the others. And it seems to me the first one that comes out and reaches across with an olive branch said, listen, we're not going to keep insulting you. Let's unify. We've got to solve some problems. It seems like, whoever does that, I think is likely to carry the day. So, political independent, I'm going to be watching carefully. And, we're under 100 days. I'm very unlikely to endorse anybody right now.
So I have to admit, this one's a little more personal, but like you, I'm out here trying to bring awareness and spread truth, of course, at a much smaller scale than you. But I've been called names, I've been dismissed, I've been made out to be crazy. And there have been times where I feel like it's made me a bitter person. And that's something
Mm.
that I don't want. And it's been a struggle. I've had some pretty dark thoughts against those people, and I don't agree with those thoughts. I want to have compassion for my fellow man. And like I said, you're doing this at a much larger scale than I am. So I'm wondering, how has this affected you personally, and how do you deal with this?
Wow. Well, there's a great interview, a German physician, psychiatrist, and neuropsychiatrist, Michael Nels. It's called The Indoctrinated Brain. He wrote a book. He went on Tucker Carlson's show. He thinks the pandemic illness and the administrative products have actually changed the human brain for people to go after each other, that we're more dull. And, I think it's important to really pay attention, as you do, Mike, to personal health. After we're done here, I'm going to go work out, despite no matter how tired or stiff I am. I think healthy doses of physical exercise, the highest quality diet we can do. I don't drink any alcohol right now. Taking care of these, the physical, spiritual, social, family domains is very important. We're in some type of great controversy. All of us can feel it right now. And I think we just can't afford to give into these dark, lonely feelings. We just have to just keep riding it out. We have to have faith that indeed our faith will pull us through these times.
Yeah. Yeah, it's tough. I don't mind being called names. That's not what bothers me. I think it's just the lack of appreciation, because I feel like I'm trying to do the right thing, and that's sometimes tough. But I'm glad to hear you're doing a workout next, because I'm about to do the same thing
All
after
right,
this.
good.
My last question is there anything else that we maybe should discuss today, or maybe said differently, is there anything that people have not asked you about that you kind of wish they would?
Well, people have said, listen, is this just a fear about infections? And I'd say the one piece of evidence that we have to really confirm we've entered into some type of time of great controversy is the transgender crisis. Where 10 years ago, it didn't seem to be any crisis. When, I was at a major academic medical center, this was never discussed. And, people have always had sexual preferences as adults, but we've never, ever thought or considered about, changing, through hormones, puberty blockers, and surgery, changing genders of children. And now we discover in 2021, the AMA said that gender should not be put on the birth certificate. I mean, I have no idea where they came from. We hear about pornography pointing to school districts. And now we're learning that the majority of children, sadly, who are marshaled forward for this transgender medicine actually have autism. So they're suggestible. They feel ostracized. That this is so heinous that 25 states have banned it. And now our assistant Secretary for HHS is trying to overturn these bans in the Supreme Court. Now, he himself is a transgender individual. His name is Richard Levine. And as an adult, he decided to live out his life in a sexual fantasy as Rachel Levine. So this tells you, this is prima facie evidence that we've entered some new time. People didn't think this way 5 years ago or 10 years ago, but they are thinking this way now. And so I encourage everybody to, be discerning, ask questions, independently validate claims. You'll hear all kinds of claims of things happening all over the world. When people have asked me about various worldwide conflicts or other things, I said, listen, I'd have to go and physically see it myself to validate it. So if I can't see it in my day-to-day practice, then I hold back my reservations on making decisions on things and forming opinions. People can't just look at some clickbait on Instagram and see an image and, form an opinion. No, these guys are bad guys. These are good guys. We can't. And be careful of these images where someone's put up a title already labeling things. We saw people go for this and then realize the images were from 5 years ago or 10 years ago. And as people it's not verified news sources. We don't have embedded reporting in major conflicts now. So we don't know if there's prisoner exchanges. We don't know if there's, mass casualties and where the battle lines are and where the fights are in the air with the planes. We don't see any of that. And so with the availability of cell phones, you'd think that if there were air battles going on, somebody would click a picture, and we just don't see it. If there were tank battles, if there were tanks battling each other, you think somebody would take a picture, but we don't see them. Maybe they are, and they're being suppressed out there, but on the internet, what have you. But we've entered a time of great controversy. Now's the time for clarity of vision, of discernment, of reflection, and getting opinions. Tuning into Mike Vera's podcast, tune into Dr. McCullough's podcast, my podcast, America Out Loud Talk Radio. Get different opinions, and now is the time for independent media. Mike, thank you so much for having me on the program.
Dr. Peter McCullough, thank you so much. Folks, stay healthy, stay awake. Hey, thanks for listening to this episode of Healthy and Awake Podcast. Please remember to leave us a 5-star rating on Spotify or Apple, or if you're watching this on Rumble or YouTube, please be sure to give us a thumbs up and leave a comment down below. Let us know what you thought, or if you had any questions based on what we talked about in this episode. And of course, it couldn't hurt to share it with your friends, those who maybe are awake, or those, of course, who are waking up.